9.2.2, and then after this, I will show what I've been doing for the quality improvement project. Okay, so you're ready, you're gonna use it. Okay, so purpose of this measure is to assess the health department's use of the quality improvement program. So like I said before, once we develop it, now we gotta show how we use the program to improve our processes and programs. Again, with just more documentation of how we do that. And we went through a couple examples here at the top. And then the last, 9.2.2, health department must document how staff are involved in the implementation of plans. So you gotta talk about and document who was involved, what they do during implementing the plan, and how they serve on that. It can be minutes, memos, whatever your director or health officer tells you to do. Are any of your health officers going to be involved?
No.
Dr. Gaff is some.
Okay. Okay. Okay, so yellow belt training. So I'll look at what I did there. Let's see, hopefully this will work. Come up.
What's it supposed to be?
Not yet. That's supposed to be that.
Oh, it was.
This takes a minute.
Oh, no.
Hello.
He's so funny about some of
The two of you.
Okay, so I'll just read it. So yellow belt certification, that was our project plan, our project for QI. Went down to Lafayette, spent a couple days down there. It's a very difficult town to get around in. I got lost several times.
Dr. Matt, it's
Huh?
a lovely town.
It might be lovely, but it's difficult to get around in.
I think it's very difficult too.
I get lost.
agree.
There was different names at different intersections for the same road that you were on, and I got lost.
It's Four Winds that way too.
It was just difficult.
The roads just changed.
So, the background. So, I had, the reason why we have to have a plan was, we had 5, the problem was complaints and how we deal with complaints in individual health departments. And the issue is we have 5 separate departments and we have 5 ways of taking and completing complaints. And so we're trying to get some uniformity and consistency in that. So that was the plan. And the reason why we had come up with that is before some of you were even around, way back, several years ago, this was talked about using complaints as the quality improvement project, back even when Allen County was still part of the group. So it was an item that we talked about a long time ago that's still stuck there. So we had to decide what it would look like if every department had the same. What standard would we say would be then successful? Would we say that every department uses the same form, that all investigations of the complaints happen within 48 hours? You know, would we call that successful? I mean, that's something what we're working on.
So those are standards that we would set.
Right, that's what I'm saying is, that's what I'm showing you today, or talking to you today about. Would that be successful in your eyes? Is receive a complaint, and we'll talk about how to receive it, and what qualifies as a complaint, and then the initial investigation completed within 48 hours.
That's something that we'll decide as a group, not like it's coming from someone.
Right, since I can't show it to you, I'll have to send it to you. And then you can review it and see what you think. So we did have at the June meeting, when we broke up into our groups, remember it was downstairs? We talked amongst each other on what it would look like as far as complaints. Because some departments require signatures, other people don't require signatures, you can just phone it in. Other people say, no, you can't have anonymous complaints. So how do we resolve this issue? And so there's lots of different terms to come up with. One thing I had to come up with is called a DMAIC. It's a abbreviation, it's DMAIC for define problem, measure it, analyze, improve, and control it. So I had to go through that process. And a form that they use is called an A3. And on the A3 is kind of like different boxes for different things, and you put in your information. So define, the definition was 5 counties with 5 different responses for complaints. Problem is, we do it differently in every department, so we want to make it consistent for everybody. So some issues that we have with complaints would be wrong information on complaints, maybe the wrong directions or wrong address on the complaint. Sometimes we let the customers fill out the complaints and they don't have the right information on them. There can be customer frustration with the time it takes us to get there, or with our ability to handle that. Sometimes we can't meet their expectations for the complaint. And then there's the health department frustration when we go out to site and it's not the right location, or the complaint wasn't correct to begin with. So we had to come up with, another girl and I had to work on this together, and we had to come up with what's called a SIPOC. That's how we measure things. So we had to look at the current process. And we had to guesstimate how often do we receive complaints that have problems in them. Complaints that aren't completely filled out or with the right information. We guesstimated maybe 10 to 20% of the time that we receive complaints that aren't complete, or that they're lying about something, or it's a neighbor dispute. It really isn't a sewage problem out there. They're just making it up because they want to get back at their neighbor. Because the neighbor called child services last month, and so now they're going to call the health department on you this month. Things like that.
Doesn't happen.
What?
That doesn't happen. Embellishing.
Yeah. And then we looked at response time for the health department, maybe a few hours to a week, depending on the availability of the health department employee. Because obviously some complaints are handled by certain employees and not necessarily others. I know that's the way at our health department. I don't know if it is at your department. If you get a septic complaint, can Tammy go look at it?
We just ignore them in our office.
Oh, you just.
We never see
Let's
them.
do that. Let's make that our pride. We are not taking
Problem
complaints.
solved.
That's right. Okay. So one of the biggest questions was, do we require a signature or not? And in our June meeting, we kind of discussed we would require a signature unless we felt it was an imminent health problem. So if somebody says, I was just driving down such and such road and the manhole, and there's all kinds of sewage pouring out of the manhole and going down the road or into the creek. Probably wouldn't ask them to come in and file a complaint for us. We probably would respond to that quickly. Or if the police department called and said there was a health issue, or if the fire department called and said McDonald's caught on fire, and he come out and take a look at it so they can open back up. Probably not going to require them to come in and file a complaint form, because we know those are trustworthy sources, or the implication of the complaint is that it's an imminent health issue where people can get sick right away. When it comes to property complaints and things like that, it probably would be a good idea for them to come in and sign for that, because more than likely it may involve a neighbor issue. What do people, that's something you guys can think about when I send that out, if that sounds good to you or not.
Or if they say they don't want to come in, they don't like they have to, or should. They still want you to address it. I had that the other day. An old man told me that, because I shouldn't have to do that. It's your job to go look at it.
Well, I think that's when we say, well, it's our policy.
Right.
I did say
And that's
that.
why we need to have the policy in place so we
Because
can say
people
that.
just call in here 15,000 times a day,
Yeah.
saying there's something we have to
We
look
should
at.
say the
We
burden
have
of
to-
proof is on you, sir.
Yeah, he
But-
didn't care.
But that's why I'm sending this out, so you guys can continue to look at that and think what you think. If that's a good idea or not, but that's kind of what we talked about in the June meeting, unless it has a specific issue that can really lead to health issues, like, I don't know of any other examples, but that would be significant. So we had to stand up at this, I really liked the meeting that we went to in Lafayette, because most of the time we were standing up, actually doing things the whole day, not just sitting at the desks. So we had lots of different colors of sticky notes, and we had to write on them and place them in order. And what we had to come up with was called a process map of from receiving the complaint through the whole process of actually going out to the site and getting to the site to review the complaint. And what obstructions, problems can occur along the way. Such as, are you the person who's investigating the complaint, is that the person taking the complaint? Because there can be a lot lost in translation. Especially if you're going to take a phone call complaint, the person who's taking it, write everything down that you felt was significant. You don't know. Do you have to call them back? Do we then have to go online and find the home site on the computer before we can get there, because we don't know for sure if that's the right address? Because a lot of people will call and say, well, they're the neighbor across the street. Well, I don't know their number. I know my house number. I'm
I
like,
get that a lot.
you're not helping me here. And I can't see the color of the home on the website. All you see is the roof. So those are the obstructions you come up with. And it takes time then out of your day to address those issues before you actually can go out and look at the site. So we're going to address all that. So we want to make sure, come up with a process so the complaint forms are filled out completely. And then if you have the chance, don't let the complainant fill out the form, fill it out yourself. Ask them the questions and you fill out the line so that you have it in your own handwriting that you can read and that you can understand. And before they leave, make sure you get all the information that you need. Trying to see what else here I need to talk about. Okay, once we have the complaint completely filled out, who, what, when, and how. So who's it given to, how is it given to them, when, and how long does it take to then actually get at the site. So if you are not the individual taking the complaint, how long does it take for that one person to give it to you, and how do they give it to you? Paper form, email, phone call. If you're out all day doing septic systems and they have your sheet here that says you're going to be gone all day long, do they wait till the next day or Monday to give you this complaint that came in on Friday afternoon, when you could have taken a look at it Friday afternoon when you're out on the scene anyway? Keep up with a complaint form that I'll send you a copy. It should be fairly simple. It's one-sided. It has some lines there to fill out what dates you were there, a narrative part of it. You can take a look at that and see what you think for me on that one. And then give me an idea of how to improve the process. Do you see any problems with it? And then let me know whether you think the 48 hours is a doable measure or not. I know that in a lot of our ordinances, 48 hours is a given time period for us to complete things. And like the contractor calls in for a septic inspection, legally we have 48 hours to take a look at that. Obviously, it usually doesn't take that long, but I thought I could apply the same amount of time for complaints. The ideal project is we'll start this January 1st. Start using the form and seeing how it works for your departments. Then we assess that again in April 1st. And then I will gather that data and give it to the lady who's doing this for our Kathy Dale for Purdue.
Did you say you were going to discuss what constitutes a complaint?
Yeah, because everybody's going to think of that differently. Every county is going to have different laws and ordinances than other ones. I think we all have septic ordinances. We all have food ordinances. Whitley County, we don't have a pool ordinance, but we have a state law that we follow. We have, in Whitley County, we have what's called a junk and trash complaint. So we go out and look at places that have just junk on it. It's not unfit homes, it's just trash. So that might be a little bit different for us. Swimming pools, like I said that. How about tattoo parlors? Does everybody have a tattoo ordinance? So I would think it would have to fall within the scope of our local ordinance or a state law for us to be able to do something about that. I know I get a lot of complaints about animals, and I tell them there's nothing I can really do about animals per se, especially barnyard variety animals. But does anybody have any ordinances on animals, specific state law? Okay. So I think we're pretty similar. If it's not within our program areas in our departments, then we can't do anything for them.
I just wondered about nuisance things like lice and scabies and those kinds of issues, bed bugs, those kinds of things that people call out that.
Well, it's difficult.
It's really a complaint, but there's no state ordinance, ordinance for it. And we try to,
You have to educate them.
but I mean, is that a complaint that you would?
Well, I mean, it all depends. Obviously, I'm going out many times for things that I couldn't have done anything for them if their complaint was true to begin with. Like if there was a certain smell at the school and they thought it was making kids sick or whatever. I could go out there, but I can't tell you whether that's something we can do or not.
And then you have equipment to test the air.
Right. Or if I go to a house that has bed bugs, even if I find them, which is pretty small, I don't know that there's a state law that lets me do anything for them. I can say, if the home is in bad conditions, that's one thing. But if it's not, you can say, I can testify about what this means if you wanted to go to court about something. So that's something we need to address, whether we take these or not, and spend time, because that,
Mold is the big one.
Oh yeah, mold in the house.
Yeah.
So, what do we do with those? Do we show up? Do we not show up? How do we? That's something else we can talk about. So, give me your idea. That's what you get the presentation. So. Does it sound like a good idea to try to use complaints, because they take up a lot of time, and if we can be more specific on that and consistent among all of us, then maybe our peoples will realize, only call us if it's necessary.
Yeah, that's.
Well, in their mind, it is
Oh, I
necessary.
know.
We need to
Everything's
solve their
emergency.
problems. Don't you know that? You need to solve our problem.
I like to, on the form that I'll send you, it doesn't have there, but I'd like to have a line that says, are you up to date on your rent? I'd like to have.
Yes.
Do you owe rent?
Yeah, they're getting evicted, that's usually in the conversation.
Exactly. Or they're wanting to get out of their lease.
Yeah.
Yeah.
And they think, oh, this will be the perfect way to
So
get
all
out
of a
of the
sudden,
lease.
I've got mold, all kinds of stuff going on.
Well, mold to them is anything.
Mildew on the
Yeah,
shower
they'll
sink.
do
Yeah.
anything,
Yeah. So any other questions for me? I'll make sure Melissa gets that and send it out. Anything else you want me to talk about with domain 9?
That's a smile.
We're done a little bit early, so that's good.
So your presentation is done before.
Yeah. Oh, what else do you have for us, Melissa?
Well, I mean, we'll just discuss a few things. Can you wrap up before we go?
Just don't touch the computer, right?
I'm not going up there.
I have a question. So what do we have to have done for our workshop? What do you want us to bring to you?
For me,
Yes.
well, obviously, we want to look at, you want to go to, when Melissa sends out the examples of the different state and health department performance management systems, you want to look at what you think would fit best for you in your department. Obviously, Dr. Hatcher has given you copies of what we have here. I think we use the Kansas one. You can look at that and see if that's something simple and easy to use. Again, we don't need to reinvent the wheel. You can look at the Ohio State template that's sent out and take a look at that and see if we can't start plugging and chugging into that our own department stuff. Look at the quality improvement project that I send out with, it's going to be a slide presentation, see what you think about that. whether you think that's a good idea or not. And if you could give me some feedback before January 1st, that'd be great. That way we can maybe say yes or no to the one form, complaint form, and
When are you sending that out? ASAP.
I will throw out there that, we've been looking at the state health department's webpage for, content with quality improvement and performance management. I don't know if you can go to our state health department site, but we are updating that and
Okay.
adding content on a regular basis, because when I got there, it was basically blank. So, in the interim, we looked at all of the states around us that are accredited with PHAB already. I will tell you, Minnesota has an amazing website as far as if you go to theirs for anything performance management, or quality improvement related. They have lots of good content. And I will work with you, Scott and Melissa,
Okay.
to see what the state already has in place, that, this might be an area that consistency would be good, because we need to show some collaboration between the state and local health departments. And you guys need that for your accreditation, the state needs that for theirs. This is a key place, I think,
Oh, sure.
to do that. So let's kind of look at that together over the next couple of weeks and see what resources we can pull together. And I'd be happy to come back up here.
Sure, sounds good.
Okay, but Minnesota is an excellent
Okay.
resource on their site. They have a lot of good information.
Good.
And I will be in touch with everyone before January 26th. I want to come to each of your departments at least once, and we can go through some of these documents that we weren't able to show today. We can walk through the self-assessment, and those kinds of things. So, I know with the holidays and stuff coming up, you know, I might be able to get some in before the end of the year, or some right after the beginning of the new year. But I'll be in touch with everyone to set up a time, and we'll do it how we've done it before, where I come in, like, kind of like we did today, a 9 to 12 or a 1 to 4 kind of thing, if that still works. But with domain 9, yeah, so I will be sending the slides from his presentation about domain 9 and the quality improvement project, the self-assessment document, some of the examples from Deschutes County in Oregon, their performance management plan, the examples, the one-page performance management overview examples from the different states. We will find the video and send that. That would be a great thing to show during a staff meeting, or something like that. It's quick 10 minutes about performance management. Scott also talked about the surveys or questions that they're using in their WIC and immunization offices. We'll have those that we can share. The Sedgwick example of their QI plan, I will forward on. And then with his QI project plan presentation, he wants feedback. Looking at the copy of the complaint form, he wants feedback on the form, and whether 48 hours is doable. So that's what I have down in my notes for follow-up. That's it. No biggie, right?